Hello and welcome back to Techerati. We're still at London Tech Show and we're very fortunate today to be joined by Dr Samira Asma, who is the Assistant Director General for Data, Analytics and Delivery for Impact at the World Health Organization. Samira, welcome.
Thank you so much for having me.
It's amazing to have you here today because obviously health is at the forefront of everyone's minds. We're going through a pandemic still, and I'm just thinking about the impact tech has had during the pandemic on health outcomes.
I think the technology has really demonstrated how we can be quick in responding to a crisis of such a scale, of historic proportions, that we had never expected that we would be in a state 24 months into the pandemic. And fortunately, the technology and the innovations really brought to fore what can be done in a fastidious manner, whether it is dealing with misinformation with regard to vaccination, for example, or to provide right supplies and materials to countries. Technology has been very central to responding to this crisis.
It seems like tech can really help us respond at huge scale. And would you say that tech can help us respond with detail and accuracy as well?
It must and it should, and I think there is a lot of technology solutions and innovations that are happening. It is about identifying where the gaps are and needs are and bridging the health solutions and combining it with technology solutions and taking these solutions at speed and scale to the populations that we serve.
Right. Obviously, we've all had to adapt our modes of working during the pandemic, and I assume that the WHO has also worked at pace to deliver, the optimum outcomes. Can you give an example of how that's really worked well?
So while WHO is working on responding to the COVID-19 pandemic, we are also responding to many health emergencies and humanitarian crises. But also it is important for WHO to continue in improving health of the populations everywhere and preventing diseases, promoting health and saving premature deaths and making sure our elderly are comfortable as well.
That's a huge undertaking. I'm wondering if you have any case studies of where technology has been applied to a context that's slightly different from COVID and the pandemic.
I would like to give you and share with everyone one particular example, which is recent, where we truly married technology with a neglected issue, such as snake bites.
Okay.
So there are about 3,000 snakes in the world, and of which only 300 are poisonous. And it is also a neglected issue because while there are 30,000 deaths every year due to snake bites, especially in communities that are tropical and people who are working in the fields, and there was not a good solution to prevent unnecessary deaths or disabilities due to snake bites. So what WHO did is partnered with the technology experts and cataloged all the snakes that are out there and their bites and crowdsource all the snakes. So we don't kill a snake, but don't shoot a snake, but shoot a picture.
Okay.
And we cataloged and brought this into a database. And in an event, there is a snake bite. Through the bite, fangs and the site of injury is also cataloged, and one can define what type of snake and whether that snake is poisonous or not. And if in the event that the snake is poisonous, the ability for this initiative to identify where antivenom is in the nearest health facility that can be geocoded so that an Uber service can take the patient within a short time to the nearest health facility and get the treatment. So this has been quite an amazing success, although at a small scale for a specific topic, but it has implications that we can apply now this technology with a problem to other health issues.
Absolutely. It's a perfect illustration of how tech expertise and health expertise can come together
Absolutely.
to solve a global issue. And it seems to me that perhaps this combination will really help in third world countries, in developing countries. And I wondered if you could speak a little on WHO's work in those areas.
Yes, absolutely. I think it is not the question of low middle income and high income countries. The pandemic has truly demonstrated that every country needs to be better prepared.
Yes.
And we were all caught off guard.
Yeah.
And even the countries that had good solutions and reported on their ability to be better prepared, what we have seen that there have been maximum number of deaths in those countries and communities, while there are many other communities and countries where there is a huge disparity in having access to vaccines, for example. That when we look at Africa and Asia, many countries are still waiting to receive vaccines and vaccinations. Although now the production has improved, we need to do better in supplying those vaccines to those who need. But I would like to also identify an area such as documenting deaths and the tragic lives that we have lost due to pandemic. Death is a fact of life, and we should have been in a very good position to account for the true death toll due to the pandemic, and we have not been able to do that. Today, what we have received as reports from the countries that there are approximately 6 million deaths that countries have reported to WHO, and we know that this is an underestimate, and we know it because 4 out of 10 deaths are unregistered, means only 6 out of 10 deaths get registered. But when we look at Africa in particular, 9 out of 10 deaths are not registered. And when we don't have deaths recorded, we would not know why people have died and what they died of, whether they died of COVID or because of an underlying condition that exacerbated during COVID. So this is an important area, and it is also a sign of governance that every country knows every birth and every death that happens in the community and causes of death, so right resources can be targeted to those that need it most. So that is an area that I think we have the tools, we know where the problems are, and technology can truly provide the means for every country to record deaths in a right manner. We could use digital solutions, IDs, and make the causes of death through routine health information systems supported by technology. So there is a lot of work that needs to get done, and I think pandemic has truly revealed those gaps, and we should be humbled that we know where the problem lies and seek solutions through partnership and marrying again health and technology and innovation.
Lovely, thank you very much for that. It seems like we're in a constant process of evaluation throughout the pandemic. Absolutely. And being honest about where we're failing as well as succeeding is key, especially in terms of accounting for human life, which is so fundamental. Are there any other areas in terms of collating data, use of data that you think need to be improved based on findings during this time?
Data is so fundamental, and intelligence derived from data. Health information is important, and health is connected to everything else. And what we have seen is that there is a lag in reporting. Data is fragmented, whether we look at it from a global lens or in particular region or in a particular country or community. What we need is a coherent data solutions so that the data is converted into intelligence. So I truly believe that every country can have access to timely, reliable, and actionable data that is also accessible. So what World Health Organization is doing is creating a World Health Data Hub in consultation with many technology partners to provide an easy access and channel to countries and communities to use the technology solutions to collate data and bring the data into a central repository so that everyone can have access to data. While we promote open data, we also are governed by data governance policies and solutions, because we want to make sure that the individual data and privacy is upheld, and data is used for advancing policy solutions, because it's good to have data, but if it is not converted into intelligence in a right manner and used to advance policies and solutions, then it is gathering dust, and which we don't want. So WHO is also working on data-driven delivery solutions, and we have triple billion targets that are helping us to make sure that we get back on track, because we have backslided as a result of the pandemic, and we have stalled the progress that we have made. So the triple billion targets is about providing at least 1 billion people coverage to universal health without having incurred financial hardship, having every country better prepared to respond to health emergencies, and having at least 1 billion or more billion people enjoying better health as a result of healthier environment. So this is possible, but we have to make sure that data is driving the solutions and taking us closer to the goals that we have all signed in the Sustainable Development Goals that need to be met by 2030.
That's fantastic. I think you've touched on environmental factors of health there, as well as personal health and global welfare. Now, I know that WHO has certain sustainable development goals. Would you like to specify a little bit about what they are?
Sure. There are 16 sustainable development goals, as you know. Number 3 is related to health and healthier lives for all at all ages. There are altogether 57 health-related SDG goals that cut across all 16 goals, whether it is related to poverty, education, gender, equity, human rights, climate, and many others. So here, health is truly a centerpiece and connects all the sustainable development goals. And similarly, partnerships does that. And more importantly, technology connects us all too. So there is an immense opportunity for embracing partnerships and identifying where we can leverage and double our investments and our contributions so that we can advance progress at an accelerated pace, at speed and at scale.
And what part does diplomacy take in all of this?
It is central, because 1 + 1 is not 2. 1 + 1 should become 11. And collaboration is key, because no single agency, organization, community can deal with a problem of such magnitude. And then when we have shared goals, which we do, when we come together, I think we can really save lives and live in an environment that is healthier, both from health perspective and economic perspective. So we can improve lives, improve livelihoods, save lives, and have better economies for everyone.
The work of the WHO is so considerable. It's covering so many bases, isn't it? And I'm wondering how you start the process of working on a project, a large-scale project. Could you talk me through a little bit about how you work from the larger scale through to the detail of human problems?
Excellent question. And under the leadership of Dr. Tedros, who is the Director General for the World Health Organization, we respond to our member states, which are 194 countries, but we also work across the UN organization, United Nations, with many partners that are multilateral partners, as well as we work with national governments and multi-sectoral organizations within the governments, not only with the ministries of health, but we know that Ministry of Information, for example, Ministry of Trade, and many other ministries are very key because health is again connected. And then we have academia, we have private sector, and we have civil society. So WHO is at the center of the global health ecosystem and global health architecture. So we have to work, and we must work and collaborate. So we identify common problems, and we provide common solutions in concert with dialogue and identifying win-wins. For example, education, working with UNICEF, or taking some solutions from World Meteorological Organization that provides weather forecast. So we could take a lot of solutions from there as to how we can provide forecast for health. And similarly, we want civil society to hold our policymakers and us accountable. Ultimately, every one of us have to be accountable to the people we serve. So taking it broadly in terms of a broad ecosystem to the communities and to the individual in a country and community, because ultimately the people are the ones that we ought to be serving.
So, Samira, we've talked a lot about seeking solutions during the pandemic, about the great work the WHO is doing. I'm wondering what you think about the efficacy of data reporting and data journalism during this time.
Journalists have done a remarkable job in timely reporting as the crisis unfolded. And many journalists even went out of their way to gather information and gather data and report on that. So we are, first of all, very grateful to the journalist community for partnering with us and amplifying the voice and messaging of the World Health Organization and many partners and countries. So thank you very much. And quality of data is extremely important because ultimately we don't want to leave anyone behind, and this should not be a slogan. It should truly be in practice, and we can't do that if we don't count everyone. That is why WHO's triple billion targets is about being accountable, about counting everyone and leaving no one behind. And this is also enshrined in WHO's constitution, in the United Nations Sustainable Development Goals. But the fact of the matter is there are significant data gaps, and we don't know who we are leaving behind. There is huge disparities, there are huge inequalities, and data is not granular enough. It is not good enough to have national statistics. We need subnational statistics. We need information about the individuals, about the communities. And there are data gaps in terms of data quality as well. So it's not only the quantity that matters, it is also the quality. Again, it is about having data that is timely, reliable, credible, that it has the coverage, it's disaggregated, so that we know from whether it is gender or whether it is socioeconomic groups, so that we can provide policy and program solutions and primary health care to those that are farthest and don't leave them behind.
It's really interesting that you talk about how all of this work needs to be filtered from government at large to local government. I'm thinking about the gaps in data and also what minority groups perhaps are invisible within that data. Have we identified those groups yet?
I'm so glad you are asking the question about invisible people. A couple of years ago, the World Bank coined the term called the invisible billion. And it's an interesting group of people. And these are the people who are invisible to us because they don't have a birth record, so they don't exist. And they don't have any documentation, so when they die, we don't know what they died of or the benefits that their families or loved ones should or could have received if they had an identity. And this is unacceptable in today's age, that we have 1 billion people in the world that are not accounted for. And when we look at the WHO's constitution or the United Nations or Sustainable Development Goals, the whole idea is we don't leave anyone behind. We want to live in an equitable society, in an equitable world where everyone have the opportunities the world has to offer. So what we are doing is working with many partner organizations in addressing this gap in providing the solutions so that every person has a birth certificate, and when a person passes away, we have a death registration and know what the person died of. And it is so extremely important that we provide the care that they need, and from cradle to the grave and everything in between. We can make our societies prosperous if we have all counted for. And at the moment we don't, and we have a long way to go, but we can go faster together and bring technology to support this work. Because many countries now have 100% birth and death registration. And those countries that have done it, we can use those models in countries that perhaps are facing the challenges and can replicate those solutions.
Samira, I'd be really interested to know what kinds of technical solutions and help organisations like WHO would need to really optimise and increase what they're doing.
There are many facets for WHO to expand its work and its portfolio, and technology and the digital solutions and innovations that are happening in this space is really, we have a prime opportunity to merge, whether it is with regard to sharing information, to address misinformation, and to gather data, collect data in a way that is much smarter than using paper pencil and using mobile and technology. So we reduce the time from collecting information to using the information, and using different geospatial technologies.
Yes.
And we haven't really tapped the AI or machine learning. Big data is an important area that we have really not unleashed yet. And we know that health connects to many other areas, whether it is animal health, environment, climate, industry. So this is an opportunity for us. We are in such an exciting time that we could leverage the innovations that are happening. Public sector is not in the business of doing cutting-edge innovation.
Right.
And we don't have to do it all. All the organizations have their unique expertise and skills, and the key is to leverage our comparative advantage and partner. And as Dr. Tedros says, let's embrace partnerships, meaningful partnerships, where we truly have a win-win-win. So bringing the best and public goods to the world. So an innovation here can have a resounding impact somewhere else. as I mentioned, I'm really passionate about solving this issue of why deaths are not registered or recorded, and why in this age and day that we don't know why a person died off. And if we do that, we could really address many problems, and we could save resources, because then we can target interventions where they are most needed.
Samira, I feel like you're in a great place for conversations at Tech Show London. I hope that we can connect you with people who you can have stimulating and rewarding outcomes with. For now, it's been an absolute pleasure speaking with you. Thank you very much indeed for your time. Thanks.
Thank you so much for having WHO represent in this space, and it has been an exciting engagement and conversations with you. And all the best with the Techerati. Yes,
hugely rewarding.
Look forward to working and taking this forward together.
Great, me too.